we decided to collaborate together as a group on the SNAPPS video and then just have one person speak on it. So I'm in a group with Kayla, Dang, and Kari. So to summarize the patient and examination session, we had a 10-year-old male with spastic hemiplegia that's in 4th grade and is a baseball fanatic. So we set up initially an obstacle course just to have a little bit of fun and see how he functions overall. And then we did a lot of baseball-related activities such as throwing, catching, balance, transfers, and we put it all into the format of a baseball game or whatever. Other typical initial exam testing procedures were done as well, such as DTRs, tone, spasticity, range of motion, MMT, etc. So the N narrowed down the problem areas to the top 4 or 5: balance, catching, tone, neglect of one upper extremity being the right upper extremity, and coordination were the top problem areas that we had saw. And then the main problem area for the A is neglecting to use that right upper extremity with ADLs and participation activities. So whether it's catching a baseball with his right hand, because a mitt is generally on that right hand, and throwing with the left hand, or tying his shoes or velcroing his shoes or putting them on, he just used that one upper extremity. So probe the instructor about any difficulties or concerns. So our questions to you are: how would you prompt a child that is dead set on doing one activity, such as baseball, also that is dead set on not using that right upper extremity? So we want the session to go well, and we want to get through the things that we have planned, but he's pretty dead set on this, so we're wondering any ideas. And then, do we need a permission slip or any additional okay from the parents to do constraint-induced therapy, such as putting his left upper extremity in like a sling or something? And then our last question is, how much do you try and force using that right hand when he is left hand dominant? So with throwing or catching, we're wondering when you stray away from just focusing on that right upper extremity and start focusing on more of the left, and what is too much therapy on that right. The second P is plan an outline on where you would start intervention next week. So our main areas of focus next week are going to be balance, coordination, and that right upper extremity neglect. And we can do this in a lot of ways, but this is brief. So we are planning on using the Wii, possibly with a baseball game or boxing, playing red light, green light, or doing some sort of warm-up before a baseball game, and trying to get both upper extremities moving and stuff of that sort, or even catching a bigger ball rather than a baseball requiring 2 arms. And then the S, what we're researching now: select case-related issues and topics for self-study. We're looking up Wii usage for patients with CP for balance and upper extremity usage, specifically compared to just stroke, which we're familiar with now. Looking up constraint-induced movement therapy with CP, and then anything on neglect and usage of the impaired upper extremity with CP. So how do we get that right upper extremity integrated, and if we can get it used, and what the research is and the background on that. So that's all we have. Thank you.